Topic of today's discussion is cough. It is one of the protective function for the human airways and lungs, which is quite essential. Whenever there's no effective cough reflex produced, we might aspirate the things or the secretions, leading on to infections and respiratory compromise in an individual. How does actually cough produced? Whenever there are some irritants, either mechanical or chemical, which causes irritation in an airway, they stimulate the receptors, which could be rapidly adapting, and the C fibers, which in turn stimulates some important potential markers like vanilloid, which further stimulates at the nerves and the vagus nerve, which then reaches onto the cough center located in the brainstem, the nucleus tractus solitarius in the medulla, which signals and the afferent signals are passing from this. Hence, the irritant is high bout of cough is produced. This is summarized in the following slide. Either the chemical or the mechanical stimulants, which are increased in an individual, they stimulate the rapidly adapting receptors and the C fibers, which causes the expression of TRP1, transient reception potential vanilloid 1 receptors, which gives its signals to the vagus and the superior laryngeal nerves to the cough center, that is nucleus tractus solitarius in the brainstem, which causes adduction of the vocal cords and expiratory muscle contraction. Hence, with a sudden release of the laryngeal contraction, high bout of cough is produced. Whenever there is a weak or ineffective cough, we are predisposed to infections and respiratory compromise. This table enumerates the causes of an impaired cough. Whenever there is a weak strength of our respiratory muscles, or there is a difficulty in movement of our chest wall, like kyphoscoliosis, either chest wall or abdominal pain. Others include when there is a glottic closure impairment in or a tracheostomized person, weakening of the muscles of the trachea and the bronchus, tracheobronchomalacia. And there are abnormal airway secretions in cases of bronchiectasis and cystic fibrosis. Or lastly, there could be central respiratory depression, like when the patient is anesthetized or comatose. What are the types of cough? It may be acute, subacute to chronic. It is defined as acute when the duration is less than 3 weeks, may be noticed in cases of respiratory tract infection, aspiration in an individual, smoke exposure, or inhalation of some noxious chemicals. It may be subacute when the duration is 3 to 8 weeks due to tracheobronchitis, maybe in pertussis or post-viral tussle syndrome. Chronic cough is defined when the duration is more than 8 weeks, which is noticed in cases of cardiopulmonary diseases, which may be of inflammatory, neoplastic, or infectious etiologies. Now, the upcoming slides elicits some things where the individual is having chronic cough, but the chest radiographs are normal in those individuals. They occurs in, first of all, the condition is by the use of ACE inhibitors, where the cough is produced in an individual due to the accumulation of bradykinins and substance P, which are metabolized by the ACE enzymes. Treatment of this cough is we can replace the ACE inhibitors by angiotensin receptor blockers. Second is when an individual is having post-nasal drainage. Here the cough is due to aspiration of the draining secretions into the trachea. The mucus get accumulated. Here the patient will be having rhinorrhea, post-nasal drip, will be characterized by frequent throat clearing, sneezing, and inflamed nasal mucosa. Treatment part includes the decongestants, antihistaminics, and nasal saline irrigation. Third condition where the person is having cough with a normal X-ray is due to the gastroesophageal reflux disease, which most of us generally heard of the complaint from the patient. This occurs because of the reflux of the gastric acid from the stomach into the esophagus, may cause of the condition of bronchitis or pneumonitis. Person will be having retrosternal burning pain, hoarseness of the voice, throat pain, and glottic inflammation is noted on the laryngoscopy. Treatment of choice includes antacids, proton pump inhibitors, dietary changes. The next condition is asthma, where the cough occurs due to the sensitization of the sensory nerve receptors by the outside allergens. The person is characterized by the wheezing, shortness of breath, and chest tightness with airflow obstruction. And these features are reversed when a bronchodilator is given to an individual. But when there's a cough in an individual due to asthma with absence of wheeze and shortness of breath, it is called as a cough variant asthma, which classically responds to the inhaled glucocorticoids and bronchodilators. Fifth condition is the chronic eosinophilic bronchitis, where the sputum is characteristically having eosinophils more than 3% without airflow obstruction or hyperresponsiveness features. The individual responds to the inhaled glucocorticoids. Treatment part, it could be antitussives, which could be narcotic or non-narcotic. Narcotic ones are the codeine or hydrocodone. They are the most potent, as directly they are going to suppress the cough center in the brainstem, that is the nucleus tractus solitarius, but their use is limited because of side effects of drowsiness, constipation, and addictive behavior. Non-narcotic ones are the dextromethorphan and benzonatate, which act by inhibiting the neural activity of the sensory nerves. Mucolytics could even be used to lyse the thick mucus by acetylcysteine, bromhexine, and ambroxol. Expectorants to expel out the sputum are sodium and potassium citrate, guaifenesin, and ammonium chloride. Pharyngeal demulcents are the lozenges, and the linctuses are also used. Thank you.